Falls are a leading cause of injury and hospitalization among older adults, contributing significantly to healthcare costs. Fall prevention programs can help reduce the risk of falls and associated injuries, potentially avoiding costly hospitalizations and long-term care needs. Example: Matter of Balance Program. The Matter of Balance Program is an evidence-based program designed to reduce the fear of falling and increase physical activity among older adults. The program utilizes cognitive restructuring and exercise components to improve balance, strength, and confidence, ultimately reducing the risk of falls and associated healthcare costs. Improving care coordination and integration across different healthcare settings and providers can help ensure seamless transitions of care, reduce duplication of services, and enhance the overall quality and efficiency of care for older adults with complex healthcare needs. Care management and transitions of care programs. Care management programs and initiatives focused on transitions of care can help ensure that older adults receive coordinated, high-quality care as they move between different healthcare settings. These programs often involve dedicated care coordinators or care managers who facilitate communication, address potential gaps in care, and provide support to patients and their caregivers. Example: Care Transitions Intervention, CTI. The Care Transitions Intervention, CTI, is an evidence-based program designed to improve transitions from the hospital to home or other settings for older adults. The program involves a transitions coach who works with patients and caregivers to develop a comprehensive care plan, provide education and self-management support, and facilitate communication with healthcare providers. Integrated care delivery models. Integrated care delivery models, such as patient-centered medical homes, PCMHs, and accountable care organizations, ACOs, aim to coordinate care across various providers and settings, promoting better communication, data sharing, and care coordination for patients, including older adults with complex health needs. Example: UPMC Health Plan's Integrated Care Model. The University of Pittsburgh Medical Center, UPMC, health plan has implemented an integrated care model that combines traditional health plan services with community-based programs and services to support older adults. The model includes care managers who coordinate care across various providers, facilitate transitions of care, and connect patients with community resources such as transportation, meal delivery, and home modifications. The adoption of technology and telehealth solutions can improve access to care, enhance care coordination, and potentially reduce healthcare costs associated with an aging population. Remote patient monitoring and telehealth. Remote patient monitoring and telehealth technologies allow healthcare providers to monitor and manage patients' health conditions remotely, potentially reducing the need for in-person visits and hospitalizations. These technologies can be particularly beneficial for older adults with chronic conditions or mobility limitations, enabling them to receive care in the comfort of their homes. Example: remote patient monitoring for heart failure. Several healthcare organizations have implemented remote patient monitoring programs for older adults with heart failure. These programs typically involve patients using devices at home to monitor vital signs, such as weight, blood pressure, and heart rate, which are transmitted to healthcare providers for review and intervention if necessary. Studies have shown that these programs can reduce hospitalizations and healthcare costs for heart failure patients. Electronic health records, EHRs, and health information exchange. The widespread adoption of electronic health records, EHRs, and health information exchange, HIE, can facilitate better coordination of care for older adults who often receive care from multiple providers across different settings. EHRs and HIEs enable the secure sharing of patient information, reducing duplication of tests and procedures, and ensuring that all providers have access to the most up-to-date and comprehensive patient data. Example: Statewide Health Information Exchange in Indiana. The Indiana Health Information Exchange, IHIE, is a statewide HIE that connects healthcare providers across the state, enabling them to securely share patient data and coordinate care more effectively. This exchange has been particularly valuable for older adults who may receive care from multiple providers, ensuring that their health information is readily available to all members of their care team. In addition to care delivery innovations, policy interventions and financing reforms can help address the rising healthcare costs associated with an aging population. Long-term care financing reforms. With the growing demand for long-term care services, there is a need for financing reforms to ensure access and affordability for older adults. These reforms could include expanding public programs like Medicaid, encouraging private long-term care insurance options, or exploring alternative financing models such as public-private partnerships or long-term care savings accounts. Example: Washington State's Long-Term Care Trust Act. In 2019, Washington State passed the Long-Term Care Trust Act, which establishes a public long-term care insurance program funded through a payroll tax. The program aims to provide affordable long-term care coverage for eligible residents, helping to mitigate the financial burden associated with long-term care services. Value-based payment models. Transitioning from traditional fee-for-service payment models to value-based payment models can incentivize healthcare providers to deliver high-quality, coordinated care while controlling costs. These models, such as accountable care organizations, ACOs, and bundled payment initiatives, aim to align financial incentives with better health outcomes and care coordination, which can be particularly beneficial for older adults with complex healthcare needs. Example: Medicare Shared Savings Program, MSSP. The Medicare Shared Savings Program, MSSP, is a value-based payment model that encourages healthcare providers to form accountable care organizations, ACOs, and share in the savings generated by providing coordinated, high-quality care to Medicare beneficiaries while meeting specific quality and cost-saving targets. This model has the potential to improve care coordination and reduce unnecessary healthcare utilization for older adults, ultimately lowering costs for the Medicare program. Implementing age-friendly healthcare policies can help ensure that the healthcare system is better equipped to meet the unique needs of older adults. These policies could include initiatives to promote age-friendly hospital environments, enhance geriatric training for healthcare professionals, and support caregiver services and resources. Example: Age-Friendly Health Systems Initiative. The Age-Friendly Health Systems Initiative, led by the Institute for Healthcare Improvement, IHI, aims to improve care for older adults by promoting specific evidence-based practices known as the 4 M's. What matters? Medication, mentation, cognitive impairment, and mobility. Healthcare organizations that adopt this initiative commit to implementing age-friendly care practices, such as engaging older adults in shared decision-making, ensuring medication safety, screening for cognitive impairment, and promoting mobility and independence. The demographic trend of population aging in the United States presents significant challenges for the healthcare system, with the potential for substantially increased healthcare costs in the coming decades. As the proportion of older adults continues to grow, the prevalence of chronic conditions, functional limitations, and the need for long-term care services will likely escalate, putting immense pressure on healthcare financing and delivery systems. To mitigate the impact of this demographic shift, a comprehensive and multifaceted approach is needed, involving strategies across various domains. Promoting healthy aging and preventive care, creating age-friendly communities and environments, enhancing care coordination and integration, leveraging technology and telehealth solutions, and implementing policy interventions and financing reforms are all crucial components of addressing this challenge. While the demographic reality of an aging population is unavoidable, proactive measures and innovations can help ensure that the healthcare needs of older adults are met efficiently, effectively, and in a manner that promotes quality of life while managing the associated cost burden. By embracing these strategies and fostering collaboration among healthcare providers, policymakers, technology innovators, and community stakeholders, we can build a more sustainable and age-friendly healthcare ecosystem that supports the well-being of our aging population.